Welcome back, y'all. Kid Illuminati 33, and I'm here with some threats, okay, that I was sent. I know I got other people doing it for me, but they want me to do something tonight too, since I'm in a good mood. I really am. Okay, this is titled New Long COVID Study Uncovers High Inflammation in Patients. I actually realized I'm actually COVID. Okay, so let's see what this means. I thought it was Alicia. Alicia want me to do another video on her because she wants y'all to know her real identity. Okay, so I'm gonna tell y'all her real identity, but she wants y'all to vote though. Okay, but yeah, I'm actually COVID. Okay, so let's see. A new study in Science is shining a light on the continuing impact of long COVID, with research revealing further and continuing health concerns for some of the 16 million sufferers in the U.S. Long COVID is a syndrome or collection of symptoms that continue or develop after an acute COVID-19 infection and can last weeks, months, or years. There is no test to confirm if symptoms related to long COVID. Some scientists suggest that long COVID is caused by overactive immune cells, but the exact cause remains unclear. The study followed 113 patients at 4 different hospitals in Switzerland with mild and severe COVID-19 and found that 40 had symptoms of long COVID at 6 months, 22 of whom had persistent symptoms at 12 months. Researchers looked at blood samples from the 40 who experienced long COVID symptoms, compared them to controls who were not infected with COVID-19, and found that those who had long COVID had evidence of inflammation, increased complement activities, blood cell dysregulation, hemolysis, and platelet activations in tissues injury in their blood. The specific details from the small study may help provide a basis for new diagnosis solutions. According to the researchers, for the condition with no known cure or FDA-approved treatments. While these results finding evidence of inflammation in patients with long COVID symptoms are not entirely surprising nor specific to long COVID, they were still forward in identifying the cause of long COVID. It's more than just researchers, though, looking into developments in our understanding of the symptoms. The condition received renewed attention from the federal government last week at the U.S. Senate Committee on Health, Education, Labor, and Pensions, covering a group of patients and experts to testify about the impacts of long COVID before a bipartisan group of senators. In the senator's first ever hearing on the topic, Senator Tammy Barron said researchers and government officials need to increase the sense of urgency over understanding and treating the condition. For Senator Bernie Sanders, chairman of the committee, more needs to be done. We think we haven't done anywhere near enough, and we hope to turn that around, he said. Medical experts testified at the hearing, telling the committee that the condition can emerge in patients of all ages and backgrounds, that the risk increases with multiple infections, and rates of long COVID are higher in minority communities. The burden of diseases and disabilities from long COVID is on par with the burden of cancer and heart disease, a clinical ethnologist at Washington University said. We must develop sustainable solutions to prevent repeated infections with SARS-CoV-2 and long COVID that will be embraced by the public, patients, and caregivers. Okay. Angela Marquez, a long COVID patient from California, testified that she had helped over 15,000 suffer through online advocacy. 1,500,000. We are living through the largest mass sustainable event in modern history, she told the senators. As she told her own story, Marquez, a former runner, said she currently on frail medications. Although she said she had managed to continue working and she has health care, the condition has forced her to work from home, lying down to minimize her symptoms. Not since the emergence of the AIDS pandemic has there been such an imperative for large-scale change in healthcare, public health, and equitable structures that bring exceptional risk of illness, suffering, disability, and mortality, Margaret Justice said. One of the senators, Republican Roger Marshall, shared his long testimony, revealing to the committee that one of his loved ones is one of the 16 million people who have suffered for 2 years with the condition. He told the committee his family members' illness is like mononucleosis that does not go away, adding that the person has seen 30 doctors in an attempt to find help. Marshall said there needs to be more focus on treatment for long COVID at the Centers for Disease Control and Prevention. I'm frustrated with our CDC and more focused on vaccines than they are on treatments, he said. Epidemiologists and researchers weighed in. Dr. Ali Allah, while testifying, repeatedly called on our country leaders and medical experts to come together to tackle the ongoing health crisis. We are the best nation on earth and we can solve this, he said. One of his proposed solutions is establishing a new multidisciplinary research institute to address infection-associated chronic conditions. Research into the conditions have been slow, Dr. Clarice Madlow Brown, PhD from the University of Ohio, said at the hearing. She noted clinical trials are in the experimental medicine phase and pushed for more investments to identify proven treatment. Senator Tim Kaine said the National Institutes of Health have been providing more than $1 billion since 2020 to study long COVID, and he urged Representative Fournier to testify before the committee. In 2021, the NIH launched the Researching COVID to enhance recovery initiative to identify further risk factors and causes of long COVID. We can't take 2 years just to get geared up, he said. According to the most recent information from the CDC, long COVID can cause up to 200 symptoms, including chronic fatigue, blood clots, gastrophoid issues, brain fog, and heart issues. Symptoms can last from months to years following a COVID infection. Risk factors for developing long COVID after a COVID-19 infection that have been identified include severe COVID-19 illness, underlying health conditions such as asthma, diabetes, obesity, or autoimmune diseases, and not getting the COVID-19 vaccine. While the interest from the senator and the new study in science are promising, more research needs to be done to find the specific cause of why some people get long COVID from COVID-19 and others do not, and to find effective treatments. Eric Hannon, MD, contributed to the report. Hannon is a resident physician in pediatrics from Columbia University, New York Presbyterian Hospital, and a member of the ABC News Medical Unit. Okay? Enjoy.